Good afternoon. My name is Shanice Palm, and today we turn our attention to a critical but often overlooked health issue: childhood cancer. Although childhood cancer is relatively rare, its impact on families can be devastating, especially when diagnosis come late. Early detection and timely access to care can significantly improve survival and quality of life. To help us better understand this issue, we are joined by the Director of Claims at the National Health Insurance Authority, Dr. Abigail Deche Kwating. She will share insights on early warning signs, the role of health insurance, and how families and communities can play a part. Director, you're welcome.
Thank you, Shanice.
Okay, so first, let's delve into this interview. I want to ask, what is childhood cancer and why is awareness so important?
Childhood cancer is a rare non-contagious disease that affects children and adolescents aged 0 to 19 years, and it's usually characterized by rapid abnormal cell growth in the body. So there are different types of childhood cancers, the commonest being the leukemias, and then you'd have the lymphomas, you also have the solid cell tumors like the rhabdomyosarcoma, retinoblastomas, and others. Wilms tumor, one of the solid cell tumors. So the thing you've already said it's rather unfortunate that we don't pick these up early. There's a high survival rate once it's picked up early, and the children respond better to treatment than adult cancers. So once you pick it up early, there's a very high survival rate for these children.
So what are these early warning signs that parents and guardians should look out for?
So I'll say that usually children are a group of people who, when they are ill, you might not pick up that they are ill because they are playing, they are doing whatever they are supposed to do as children. And in local parlance, we'll say, "Nkwala, almost say yare." But that notwithstanding, you'd notice that the child has a high persistent fever that does not go away. They're always tired, they are not eating well. They could have a lump or swelling on the body. Maybe their eye is bulging out. There could be swelling of the lymph nodes around the neck. There could be a mass in the abdomen. There could be a whitening of the pupil. That's called leukocoria. So for those who have a retinoblastoma, you'd notice that there's this whitening of the pupil that would come to your attention. And it has to be picked up early. Once it's picked up early, this can be treated quickly for these children.
Does NHIS cover all the childhood cancers?
NHIS does not cover all the childhood cancers, so it covers the leukemias. So under that, you'd have the acute lymphoblastic leukemias, acute myeloid leukemias. Then you have the chronic lymphoblastic leukemia and the chronic myeloid leukemias. Again, it covers some of the lymphoma, non-Hodgkin's lymphoma, which is the same as Beckett's lymphoma. And then it covers retinoblastoma that affects the eye, and then Wilms tumor that affects the kidney. So these are the four major childhood cancers that NHIS covers.
Can you give us the details of what exactly it covers?
Okay, so NHIS will cover the consultation, diagnosis, treatment of these ailments. So in terms of treatment, hospital admission, it covers chemotherapy, radiotherapy, and surgery for these cancers as needed, particularly the Wilms tumor. You'd have to take some of the tumor out as needed, yes.
How many children have been treated fast since it was added to the benefit package?
Okay. Childhood cancers was added to the NHIS benefit package in July 2022. Claims started coming in 2023. So 2023, we had 83 children. 2024, 288 children. And then 2025, 230 children. So that's a total of 543 from its inception till date. We've treated 543 cases. And that's in terms of value or monetary terms, a little over 1.3 million Ghana cedis for the treatment of childhood cancers. Yes.
What roles can families and communities play in supporting affected children?
You know, usually even for a child, when they hear you have a diagnosis of cancer, everybody is like, that's the end of the road for you. So there's a bit of stigma associated with this diagnosis of a childhood cancer for any child. What I would say is that families should treat these children just as they would treat any other child to erode that stigma. And then the family should be able to understand what it is and get to understand that there's a high survival rate. Being diagnosed with childhood cancer is not a death sentence. It's actually your ticket to life. Because once we pick it up early, the survival rate is very high. So they should be there to support these children and not treat them as if they have some kind of contagious disease. It's not contagious. There are a lot of myths associated with childhood cancer because you have a swelling somewhere, lump somewhere, your eyes bulging out, but they are not how do I put it? They are not different people from anybody else. They should be treated like everybody else. And then they should know that this is something that is curable. There's a high survival rate for childhood cancer.
So all this boils into education.
Yes, yes, yes.
This year's theme for childhood cancer is challenge to change. This discussion that we are having, I want to know that how does it connect to the 2026 theme, which is challenge to change?
So once you're diagnosed, like I said earlier on, if you have a diagnosis of cancer, people feel this is a very difficult disease, you're going to die. But the good news is that there's a high survival rate. So once the difficulties inherent in the diagnosis and the management of the disease can be surmounted by the other end of the story, which talks about survival and cure and being able to live a normal life. So in my mind, that's how it translates to the challenge to change theme.
Director, can you share some positive stories to encourage vigilance, hope, and collective responsibilities?
Okay, so what it is that I remember during my house many years. This was Confanoche, and Confanoche has a wide catchment area, so you get a lot of people coming from the rural areas and all. And usually, when the child has a swelling or something, people feel you are going to die, or they feel you've been jinxed, or how do I put it? You've been cursed, right? So then they come to Confanoche or they are referred. Most of them are reluctant to come. But once they come with a very huge swelling. And then we start the chemotherapy. And you actually visibly see that the swelling is going down. So you can have a mass as big as, say, a watermelon. And after each cycle, they come back and it's shrinking. This watermelon is shrinking to, like, say, an apple, a lemon, a lime. So you actually see visibly that these childhood cancers can be treated. So what I'll say out there is that, look, it's not like the other cancers where an adult gets cancer. Most of the time, we pick it up late and they die. For children, there's always the other end of the spectrum which talks about survival and living a normal life. So those are some of the things I'll say about childhood cancers.
What's your key message to parents and caregivers? Final question.
What I'll say is that childhood cancer is not a death certificate. Neither is it something that should make you feel ostracized or cut off from society. Being diagnosed is a blessing in itself. And once you're diagnosed, follow up on treatment to the end. Once that is done, there's a high survival rate for the family and for the children because you get to have your child back. And this child doesn't die. This child grows to be an adult. There's a lot more that this child can realize for him or herself. So let's not see it as a death certificate or a death threat or something that means this child is going to die, like the way we view cancers for adults.
Thank you very much, Dr. Abigail, for sharing these valuable insights. Really appreciate it.
You're welcome.
Childhood cancer may be rare, but early detection can make all the difference. By staying alert to unusual signs, seeking medical care promptly, and leveraging the support provided by NHIS, we can truly move from challenge to change. That brings us to the end of today's discussion. You can follow us on our various social media handles displayed on the screen, or do visit our website www.nhis.gov.gh. My name is Shanice Palm. Stay safe, stay informed, and stay aware.